All right, so now the real fun begins. Ian, Chris, great seeing you guys. Look, we have the next part of today's agenda is a shockingly amazing group of companies. I've had the opportunity to spend the last few weeks with some of them, and you might call these startups, but these are more than startups. These are companies that are actually, they have amazing traction in amazing niches that I think 4 or 5 years ago, a number of us couldn't think about. So, basically put on your seatbelts, buckle up, and it's going to be super exciting. I'm Marc Goldstein from UCSF Health Hub. I'm a volunteer and chairman of UCSF Health Hub. And my day job is I'm a venture capitalist. I'm a venture capitalist at a firm called Builders VC. I'm going to be one of the judges today for some of these companies. And I will shortly introduce some of the other judges, and then we'll get right into the companies. Again, great companies, and they're going to be focusing on what makes them different. Not only what makes them super different, why is their niche and where they're focusing, because we all know the HIMSS and the doctors on demands and the IMWells are starting to sort of move into this space. What are these guys' niches and why they're so important and why are they winning them? And that really gets to their superpower. And so you're going to hear from all of these folks what their superpower is all about and why it matters. I'll get back to the company shortly, but I'm going to, judges, I'm going to hand over to you. Why don't you each introduce yourself? Who goes first? Kevin, Nico.
Hey guys, I'm Kevin. I work at a venture fund called Mashmar Group Ventures. I helped start it up around 3.5 years ago. Jumped over from another early stage fund called Crunch Fund at the time. It's now Tuesday Capital. I worked with the founder of TechCrunch and a longtime partner from Morgan Stanley Venture Partners. Was with them for a couple of years, then helped found MGV. And one of our first investments around 3 years ago was in a enterprise-focused mental health startup called Modern Health. It's been doing pretty well. That I got involved with because I actually worked at a similar company right out of college. So very excited to hear everybody's stories today. And who's next?
Nico.
Hi, good afternoon, Nico Arcino. I was formerly at Kaiser Permanente for nearly 26 years, been in healthcare for around 30. I'm currently now advising startups and Fortune 500 companies in my spare time, along with playing tennis while I look for what's next on the horizon. I'm glad to be here.
Fantastic. It's a great group. And I don't know, did Elisa come? Do I see Elisa? I do not. Okay, great. Well, there you have it. Let me basically very quickly roll through the companies, and then we'll go through the list. Now, each company is going to be given approximately 5 minutes. Again, they're 5 minutes. Their focus is you're going to find out all about them, and at the end, they're going to basically tease out why they're incredibly amazing. We're going to basically pepper them with some questions at the end. Oh, by the way, if you guys out there have other questions, get them into chat, because we want to hear. We really want to challenge these guys. At the end, we're going to basically pick some of the ones we love. Now, we love all you guys, but we got to pick. We got to pick somebody, and we'll pick a few of you. And look, I wish we could give you $2 million, but there's probably someone out there who will. So with that, I'm going to quickly run through the companies, and then we'll start from the top. We have Alex Alvarado from Daybreak Health. Alex, wave your hand. Oh, there he is. Vijay Rivender from Floreo Tech. Vijay, there he is. Chris and Alex Naoumidis from Mindset Health. Alex, great to see you. Ed Gaussen from Mantra Health.
Hi, everyone.
Oh, he speaks. Nathan Reed from XFERALL. Hello, Nathan. Kara Cragen from Hello Aliva. Well, Kara's not going to win. Sara Potler LaHayne from Move This World. Hello, Sara. How are you? And Kimberly, did you join us? Kimberly Sarong from Tiatros? Oh, perfect. We got you. She's probably more tired than some of us, but we're really glad you could make it. Guess who gets to go first? Alex, you get to go first. So I'm going to turn it over to you. You can take over the screen and do your thing.
Thanks so much, and thank you all for having me and putting on this fantastic event. I will share my screen here. So my name is Alex. I'm the CEO at Daybreak. At Daybreak, we've built the first digital mental health clinic for adolescents and their families. We've talked a lot today about the niche needs in behavioral health and the niche populations. And we look at the 10 million teens in the US alone that are struggling with mental health needs, and that was pre-pandemic. And during the pandemic, there have been reports that 50% of parents have reported new or growing needs from their teens with regards to mental health. So that's the problem we're trying to solve at Daybreak Health. And what I wanted to start with is a little bit of why adolescent care looks different and why the challenges are unique with adolescent behavioral health. So we think about three things. Number one, access looks really different for families. The most important thing to understand about access when you're working with teens is that the parent has to engage. And unfortunately, right now, we're in a situation as a society where parents are a little bit behind on the educational awareness curve when it comes to mental health for their teens. And that's the first thing that we need to solve in order to get teens the care they need. In addition, funding for adolescents looks totally different than the adult market. And we've heard from a lot of great folks today that are going after the employer space, and that doesn't really work when you're trying to reach teens. So I'll talk a little bit more about Daybreak's go-to-market, but that's problem number one that needs to be solved. Number two is there's just a lack of family-centered care models, right? I think we've really built a lot of evidence up as an industry around care models for single individuals that are generally adults. And those historically have been focusing more and more on things like CBT, but clinically validated family treatment models are very rare. And so we're innovating on that as well. And then lastly, the adolescent care ecosystem is really, really fragmented, even more so than the adult ecosystem. So as an adolescent, you might be getting care at school. You might be getting care from your pediatrician, which is most of the time where parents are going to start. You might then go to a therapy office, and you might also get referred to a psychiatric office, and all of those are not going to be working or coordinating together. So these are some of the problems I just want you to keep in mind as we go through Daybreak today. So Daybreak's solution, in a nutshell, what we are building is, as I mentioned, the first digital mental health clinic for adolescents. And what that has is it's three different levels, and I'll actually start you at the bottom here, thinking about first family awareness and education, moving up to family-centered counseling services, and then at the top of the pyramid, medication management. And think about this pyramid as the base being pretty much everyone could benefit from this type of service, and at the top, obviously, a subset of families are going to need this. And so Daybreak offers all three levels. As I mentioned, access and awareness is such a critical component, and so we offer free classes for parents. We also offer digital assessments for teens as well as for parents. The majority of our membership base today is in that middle level. So coming up and doing family-centered counseling services, which has both the teen component with a personalized counselor match, evidence-based treatment plan, and measurement-based care, as well as the parent component. We're bringing them in for coaching, one-on-one parent sessions, and then family therapy even in some cases. That's that family-centered treatment model that we're really innovating on. And then medication management as well for the families who need a little bit more support than therapy. The other thing I'll say about Daybreak, and I know we're running short on time here, go-to-market is everything in healthcare. As we all know, the best product isn't always going to win, and you really have to be thoughtful about your go-to-market. And for Daybreak, that's really two pieces. Number one is the community partnerships that we're building. So we think it's really important. I talked about that fragmented ecosystem in adolescent care. We think it's really, really important to integrate and work well with where kids are already getting their care today, whether that's at the school, whether that's with pediatrics. And so we've built partnerships in both of those areas. Number two is really how do you get paid for the care? And we talked a lot about today, a lot of these companies are going D2C, and that's a great place to start. But really, when you're thinking about adolescents, the payers in addition are different, right? It's not just private insurance, it's not employers. You really have to start thinking about public funding, school districts, Medicaid. 40% of kids are on Medicaid in the United States. And so you really can't build a solution without going down that route. And that's the direction Daybreak is heading, building on the great school partnerships that we've built in the early days. The last thing I'll say here, we got a fantastic team that's building this. We all have experience at the intersection of healthcare technology and behavioral health. We've been backed already by Y Combinator, and Maven led our seed round. We heard from Zoom earlier today. Maven was the first investor in Zoom. So we really do believe that the Zoom ecosystem is part of what's going to help us push forward. And I'll just wrap by saying our mission is creating a world where every young person benefits from mental health support. I know Marc really wanted a superpower, and what I'll say is that our laser focus on adolescents, understanding the solution they need, as well as the community and the ecosystem within which that solution can be most successful, is our superpower. So thanks, and I'll wrap with that.
Nice. I got a question. Judges, you have any quick questions for Alex?
I'll start off. This is Nico. What is your top priority in the next 6 months?
The top priority is making progress with the payer ecosystem that we've started with. So today we operate as an out-of-network provider with several payers in California, which is where we operate. But we're moving in network not only with private insurance, but we're also exploring and actively working towards contracts with Medi-Cal as well as school districts.
Great. I got a question. Why, product-wise, how are you different? We know that there's look, we've heard even all day long from other companies in the space. What did you build that's fundamentally different here?
The fundamental thing, we call it, internally, we call it multiplayer mode, which is a little bit of a cheeky reference, but it really is, when you think about the solutions that exist today, just from a product perspective, they're built for a single stakeholder, right? An adult is usually engaging in their own therapy. You don't need to think about multi-stakeholders. And so we've built a mobile app for teens, a web app for parents. Those two things play well together and both integrate with the counselor experience. And then on the services side, the parent and the teen are both involved in a different way, but in a joint and cohesive way in moving the ball forward on the treatment goals and measuring the progress towards that.
Got it. So parents and teens are involved, and you basically build an app that is very teen friendly. That's thus multiplayer. That's great. Kevin, should we move on?
What's the payer breakdown? Alex, good to see you again. What's the payment breakdown right now? Is it mostly being paid for by communities, or is it a lot of out-of-pocket expenses?
It's mostly out of pocket, and the minority, but a growing share is private insurance.
Great.
I have a quick question for Alex. How are you measuring outcome? Are you including academic performance or absenteeism from school or other teacher feedback as part of your outcome?
It's a great question. We're moving more in that direction today, though. The core of what we measure is the evidence-based healthcare metrics. So the GAD, the PHQ, we use one called the WHO5, which is more a measure of overall well-being and a positive movement. And then we also measure from parents the behavior changes at home that they're seeing. Bolting schools into the picture is something that we're actively working towards, and probably for the next school year, we'll be able to have a little bit more around that.
Great. That's awesome. All right, we're going to move on to Vijay from Floreo Tech, some VR therapy for autism and related disorders. Vijay, take it away.
Great, thank you. Hi there, my name is Vijay Rivender, and I'm the CEO and founder of Floreo. At Floreo, we're using virtual reality to build an essential behavioral therapy capability in this era as we move towards teletherapy. Our story starts in a really personal place. A few months after this video was taken of my son, he started displaying developmental delays. Those delays led to a diagnosis for autism. And from there, we went on a journey, thousands of hours of behavioral therapy over years to build social and behavioral skills. Along that way, a magical thing happened. When he was 6, he saw me with an Oculus DK2 and a Samsung Gear VR headset, decided to try it out. His first experience was magical. He started pretend playing for the first time, and that was the moment Floreo was born. What we do at Floreo is we create clinically designed therapy content in VR. We deliver that to mobile virtual reality headsets. We pair that headset with a coaching console for supervising adults. This enables therapists, special educators, and parents to step into active therapy, seeing what the child is seeing in VR, providing coaching and recording data. And most importantly, for this age that we're in, that coaching console can run either in person or remotely as a telehealth application. We've built a proprietary process for rapidly creating VR therapy content. We can create new lessons in less than 3 weeks, and we have used that to create a large catalog of today over 175 lessons that span early social skill development, life situation training, including safety and emotional regulation content, and a growing suite of executive function content as we expand into ADHD and anxiety. We've invested in heavy-duty research to get here. We were awarded an NIH Fast Track grant, which has powered over $2 million of research with Children's Hospital Philadelphia. This has been done in a CBT setting and has included a successful randomized controlled trial presented at the International Autism Conference just a couple of weeks ago. Our first study showed clear quantified improvement in eye contact after 5 weeks of intervention and was published. And we have a unique partnership today with NIH's National Human Genome Research Institute, where they're using our platform to co-develop a set of ADHD interventions that will be researched this year and early next and available next year. We've been commercially offering licenses to providers, primarily therapy clinics, as well as special education districts. We've grown from 11 enterprise customers a year ago to now over 70. And we professionalized sales as we start to add salespeople and accelerate growth in 2021. Where we're going is a Series A at the end of the year. We're looking to grow autism, commercialize ADHD and anxiety. We see this in the long term as an FDA medical device, so we see a 510(k) path for the product. And key to reimbursements, which I'll talk about in a second, and one of our superpowers, is our novel use of Medicaid. And in the long term, we see scaling by using our patented platform to also enable other research organizations to develop new therapy content. State Medicaid programs are vital to how US therapy is delivered today. Over 50% of kids with special needs receive Medicaid services. We have Medicaid approval today in Maryland, DC, and Wisconsin. And we're in conversations with a half dozen other states to expand our Medicaid reimbursement. We're able to then offer Floreo to providers as an assisted technology reimbursement if they choose to use Floreo with patients. We believe that will drastically reduce the friction in offering Floreo to providers. Separately, we're also using novel methods of using parent training to directly work with families. You might be thinking, how is this company going to create all the content needed for all the different types of therapy out there? As a platform, we've built an ability to create and mix and match content. And part of the investment in the next 2 years in our product roadmap is a studio product to enable any other organization to be able to take existing therapy lessons as templates, customize those, and build out new areas, including new health indications that we might not be in today. Thank you to Vader for giving me this opportunity. Again, we're Floreo, we're using virtual reality, and we believe we're building an essential, indispensable tool in the era of teletherapy. Thanks.
Nice. Which judge wants to go first? Kevin, you get to go first with a question.
That was really cool, Vijay. Is the coach typically in the room with the person who's going through the VR experience?
About 2/3 of our customers are in person. About 1/3 are using it as a telehealth application. So they'll fire up video conferencing in tandem with our coaching app and do that remotely.
Ah, okay, cool. So they're the kind of the guide through the scenarios and all right, that makes sense. What are the most common in, I guess, game applications? Is it mostly running through like real life scenarios?
Yeah, so based on the developmental target age, the style of animation can go from quite cartoony to realistic. So to give you kind of a range, we have lessons to develop eye contact with cute safari animals and motion. To the other side, we have lessons where you learn how to interact with police officers safely, because that's a huge fear area in the community. And so there we use realistic animation styles as the officers confront someone and say, hey, what are you doing? And you're able to build the composure and manage the anxiety to navigate that.
Yeah, this is really cool. I can see how it'd be great for kind of running through and practicing scenarios that might surprise you in the wild.
I got a question. You said you had 70 enterprise customers. First of all, this is amazing, in part because I guess you got that nice grant and seed capital because you're performing like an A company. But talk about, who are these 70 customers? How much are they paying you?
Yeah, so they range greatly. So our biggest contract size is about $30,000 a year. Some are as small as hundreds of dollars a year. So some therapy clinics are mom and pop operations, a handful of clients. We're moving up the ladder with pilots at some of the larger private equity-backed therapy clinic businesses like Cadient. We just signed a pilot with Easter Seals of Southern California. So there are large players, and then there's a long tail of smaller players. And our sweet spot is today more on the smaller side because they're looking to innovate and distinguish themselves against the big players.
Got it. Nico?
Yeah, Vijay, thanks for that. And this is close to home. My son is also autistic and he's 16 now. So I wish there was something like this when he was going through diagnostic testing and MRI. So especially for the anxiety portion of that. That said, I think you really, what Marc just asked around Easter Seals, and they really contract to so many different mom and pop shops and across speech and language processing to ABA and different services. And that said, what's your biggest barrier to growth with that diversity of things that you're trying to solve within content?
Yeah, it's really the fitting into the operational processes of providers. You have a clinical challenge, which is how you need to be effective enough that it's worth changing what you're doing right now. And so you have to be not just slightly better, you have to be better enough that you overcome inertia and change. And you end up seeing that both on the clinical side, where clinicians are comfortable doing something and here's some really fancy new technology, but also on the business side, because right now for these clinics, we're an out-of-pocket or infrastructure cost to take in our system. And so we see reimbursement approvals in states as really vital because we want this to be a win-win. We want providers to choose to use us because outcomes are going to improve and they're going to continue to make or even more money because of reimbursement opportunities that might show up. And a big reason today for the growth we've had is that we allow you to expand your telehealth capabilities. So right now, video conferencing is very limited when you're talking about, adolescent behavioral therapy and what you can really accomplish. And so the Floreo lessons in VR that immerse the child end up expanding what you can do over telehealth.
Thank you.
That's great.
Quick question on the same line with Nico. Are you integrated with solutions like Rethink or other kind of corporate health type solutions in the ABA space?
Yeah, not yet. We're aware of the big one is Central Reach in the ABA therapy space. Actually one of the co-founders of Data Finch Catalyst, which is one of the other bigger players that's now owned as part of KKR's therapy brands, has actually joined our team and oversees operations and sales. So we see integration in the future with the practice management EHR world as really important. Today we offer CSV files and kind of old-fashioned glue-based ways to kind of get people going because we haven't gotten yet to the place where we're ready to invest engineering resources on that.
Yeah, no, I'm not talking about EHR integration. I'm actually talking about going to the employers because this is kind of, yes. It's a big caregiver dilemma. Like it's important for a lot of go-to-market strategy to have something like this also as offered.
Right. So our strategy to date has been to use state Medicaids as a springboard to then get to commercial payers, including self-insured employers. So we've had conversations. We want to get there the right way, and that includes being able to be made available. So we have done some pilots with employers where they've done a very poor job of alerting the families at the company that they actually have the solution available. So I've called it, in one case we were next to discount car washes, but definitely Rethink is a company that we pay a lot of attention to because they've been very successful. Thanks for the question.
Hey, Vijay, thanks. This was awesome. You've obviously got us all going with questions. Great job, Floreo Tech. Alex, you're up next with Mindset Health, which is hypnotherapy for IBS, menopause, and more. Alex, take it away.
Thank you. Yeah, so I'm Alex. I'm the co-founder and co-CEO of Mindset Health, and we're building hypnosis-based digital therapeutics for underserved health conditions like irritable bowel syndrome. So stress, anxiety, and depression not only have a mental health impact, but can impact many aspects of our physical health, from amplifying the perception of pain to decreasing immune response and triggering diarrhea and constipation. If you're sick, but you have a positive mindset, your brain is likely to produce chemicals that will boost your body's ability to heal itself. Think the placebo effect. And on the flip side, negative expectations and mental health conditions can prevent the brain from producing these chemicals, as well as changing how you perceive your symptoms and discouraging healthy behavior. So our mind and body are closely interrelated. How you think can affect how you feel, and how you feel can affect how you think. And understanding this relationship can open up new ways of managing both our mental and physical health conditions, including hypnosis-based digital therapeutics and interventions. Hypnosis uses focused attention and focused attention and heightened suggestibility to facilitate learning and enhance the mind-body connection. A 2016 Stanford study found that hypnosis altered areas of the brain associated with the brain-body connection, absorption, and decreased self-awareness. It's not a therapy in itself, but it makes therapies like CBT and guided imagery more effective. But it's been largely overlooked due to outdated misconceptions and a lack of access to qualified practitioners and affordable options. It's in a similar position to where meditation was 7 years ago, except it's focused on health outcomes for specific conditions. We're going to change that by making hypnosis-based therapy accessible through digital therapeutics. We partner with world-leading researchers to take evidence-based hypnosis programs and deliver them through mobile apps. Hypnosis is uniquely suited for mobile app delivery because even in person, it's an audio therapy, which allows users to self-manage their condition at home whenever they need, for 10% of the cost of in-person therapy, and accessible without a prescription. We're starting with irritable bowel syndrome. IBS is a chronic gut-brain condition that affects between 25 and 45 million Americans. Symptoms include diarrhea, constipation, and pain, and there is no cure. Most people rely on restrictive elimination diets, symptom-specific medication, and inaccessible, expensive therapies. We're building the best tool to manage IBS, an app called Nerva. It's a daily program of hypnosis-based guided imagery, psychoeducation, and breathing exercises that can help people with IBS self-regulate their symptoms and address the miscommunication between their gut and brain. It doesn't require a human in the loop, and we've grown to thousands of active members through direct-to-consumer growth model. Our program is based on a peer-reviewed randomized controlled trial from Monash University, who developed the gold standard elimination diet low FODMAP for managing IBS. And they found that gut-directed hypnotherapy was just as effective as this elimination diet, but didn't require any diet change. We're going to build off this playbook and replicate it for a series of other underserved health conditions, from menopause to depression, sleep, and chronic pain. We're supported by a team of world-leading experts from Monash University, Harvard, and Baylor, along with leading investors like Y Combinator, 50 Years, Banana Capital, and Giant Leap. And with their help, we're going to be making hypnosis-based therapies accessible for 1 billion people who have access to a phone, but not good healthcare. My name is Alex. I'm the co-founder of Mindset Health, and we're building hypnosis-based digital therapeutics for underserved health conditions like irritable bowel syndrome, menopause, and chronic pain. If you're a healthcare practitioner looking to refer our products, or a partner who wants to partner with us, we'd love for you to get in touch. Thank you.
Great. Nico, you go first.
Sure. Yeah. Wow. That's really interesting. Tell me, you mentioned IBS as the first target for your product. Why is that? What's the definition behind that, or what's the the special need there?
So it's a functional condition. So there's no actual damage occurring to the gut. It's just a dysfunction with how the gut works. And so it really responds to these mind-body based therapies like gut-directed chemotherapy. It's also really hard to manage and there's no cure. So as a celiac, someone with celiac disease and having to follow a gluten-free diet, like having an ability to do something like this and not having to follow an extremely restrictive elimination diet like low FODMAP was really appealing. And so that was largely like the need and where there's a lot of research. So Monash University had this RCT, we were able to license it. So that accessibility to that was a big part of it.
Nice. Kevin.
What's the form factor for each of these? Are they each individual apps or are they all going to go through the same interface?
Yeah, each individual app, so we can really tailor it and personalize it to the condition, but we're building a shared infrastructure layer. So a lot of these programs are very similar, like a 6-week core program plus ongoing maintenance of audio recording, psychoeducation. So
yeah, similar module, similar form factor, just different branding and all
exactly
towards either the doctors or the, okay, yeah, that makes sense. Cool.
So I got a big question, Alex. You probably heard this before. Who's paying for this? I assume it's early on. You're probably not reimbursable yet, but tell us about this. Who's paying?
Yeah, so at the moment, direct to consumer, we think, especially in the early days and through this product development, aligning with the end user and building something they love is one of our advantages. At the end of the day, we can use the data from retrospectives and RCTs to then layer up into insurers and self-insured employers. We've actually have had one transaction reimbursed in Australia. So that was actually this week. So that's really exciting. But largely, yeah, 99.9% consumer at the moment.
Got it. That's where you start.
How much does it cost?
$67 for 3-month subscription.
Cool.
Great. Well, this sounds like this is amazing. You're earlier on in the journey, but what an amazing journey. This is a super cool product, Alex. You guys have to be really proud about what you built. I love it.
Thank you.
All right, and with that, we're going to move on to Ed. Ed from Mantra Health, mental health platform for university students. Ed, take it away.
Thanks, Mark. Thanks for the intro. Let me share my screen quickly. All right, so today I'm going to be speaking about how Mantra is reimagining mental health care for university students. And I always like to start by talking about an obvious statement here. University students are going through a mental health crisis. I think that especially in the US, this is a pretty well-known fact. What is a little bit less known is how colleges and universities are really failing to meet the demand of mental health care for college students. And so to go into the numbers a little bit, the rates of anxiety and depression amongst college students have really increased over the last 10 years. So there's a survey that came out from the Journal of Adolescent Health in 2019 that showed that those have sort of doubled over the last 10 years. And you can look at different studies that are coming out, but they all point to some pretty mind-boggling statistics where, for example, another one that came out last year is that 24% of college students are on some kind of a psychiatric medication over the last 12 months. And during the pandemic, 1 out of 4 young adults had contemplated suicide during the pandemic. So if you're looking at that side of the screen and then looking at the right-hand side, what universities are trying to do is unfortunately not enough, and they're struggling to provide the care that students need, where the wait list at the counseling centers can be as long as a semester. Providers are really difficult to hire at the counseling centers, especially in rural areas. And so universities are now moving towards this sort of short-term therapy model where the available care for students is being reduced and then they get referred out to the community. And so with that sort of broken experience and sort of urgency and need, we think there's an opportunity to build a very large digital mental health practice that's entirely focused on the university student population. There's 20 million university students in the US. We talked about how big the numbers are in terms of the needs. And so quickly to introduce the team and myself, actually by background was a venture capitalist, not a mental health provider. I did have a sibling that had to drop out of college because of her own mental health. And so how complicated the experience was. My co-founder, Matt, who I met during my time as a VC, did have a similar experience himself while he was in college. And we partnered with Dr. Shah, who is the medical director of Columbia University Psychiatry Faculty Practice, and together built our provider group, which currently is live in 8 states. We're scaling across 50 states with this year after bringing on board more funding from Canaan Partners and other top venture capital funds. And so today we're working with some of this country's big institutions, already deployed on 26 campuses with over 180,000 students enrolled. So the growth has been really fast with the tailwinds of COVID, where campuses have had to shut down and look for digital solutions overnight. And really, we've built an experience that wraps around the counseling center. And so the core of our experience is powered by a piece of software that's not shown in the screen that's called the Collaboration Portal, which allows school to refer students into Mantra. Students also have the ability to sign up on their own for campuses where we want to enable that capability. And after that, we really built an experience that allows students to pick providers that best match their needs. They can interact with providers through video visits, 24/7 messaging. We were talking about measurement-based care earlier. At Mantra, we use the PHQ-9, the GAT-7. We also use the Sheehan Disability Scale that allows us to understand the impact of our program on the student's life, whether it's academics or social life. One thing we're able to do as well as we deploy on campus is integrating the campus resources so that again, we're able to refer a student back into in-person services if needed. And that's something that's extremely customizable at scale with the universities. And lastly, we've built a lot of psychoeducation content, especially when it comes to medication management, to remove the scaries around getting on meds for students that need it. And one last thing I'll say about Mantra is that one thing that makes us particular versus a lot of the other telemental health companies that are trying to focus on the college space is that we've made a lot of headways when it comes to working with payers. And so today we're in a network provider group with Aetna, Cigna, Blue Cross, or Optum, depending on which state you're looking at. And we're looking at this strategically as a way to increase the market size where we're not necessarily reliant on the university sales cycles and budgets to work with schools. We use that as a way to remove some of the burdens, the financial burdens that the schools have, and accelerate the adoption of our program. And so that's part of why we've been successful so far. And also looking at different go-to-market strategies where today we've got existing partnerships with brokers, with other constituents in the marketplace that allow us to grow fast. That's as much as I can share. But this year you'll see us raising a Series A and effectively, looking to achieve market domination over the next 18 to 24 months. So really excited about the opportunity to pitch today. If there's any questions, my email is here, and excited to hear the questions from the judges.
Okay, who goes first?
A quick clarifying question. You said you're a wrapper on the clinics. Are you wrapper on the existing resources that colleges have already kind of put together, or do you augment that with outside providers?
That's
video visits.
That's a great question. So we are effectively a separate clinic from the on-campus clinics. And when I say that we wrap around, we've built our own workflow integration tool. So we sell that as a SaaS to the school on top of the clinical services that we sell to the schools. And so that SaaS allows them to make seamless referrals into care with Mantra. And then over time, because we've built our own EHR, get access to medical notes. And so if a student is in crisis, walks back into the counseling center, they know exactly what's been going on.
Yeah. My question's sort of like that. So are you a part of a triage system, maybe that might include on-campus counseling, or are you at this point still separate?
No, so we effectively make the triage system easier with this platform that we've built. And so schools will have a counselor on campus that historically will have had to take a list of providers that exist in the community, phone up all these providers to see who can take the student's insurance. The student has to travel out of campus. Usually the first appointment is available in 2 to 3 months.
So you guys are the front door. So you effectively, when you sell into a university, you're the front door for mental health, sounds like.
We can be, or it can be triaged at the counseling center, after which the student is sent to care much easier than they would be sent to care in the community with Mantra.
Can you share any of the data you have with maybe your first adopters? What, number of students that are opting in?
Yeah, I think the most exciting public data point that we can share today is that if you look at when a counseling center refers into the community, data that we got is that only about 30 to 50% of students actually make it to that first appointment. On our accounts this year, up to 97% of students make it to their first appointment with Mantra. And so students falling through the cracks is really where you start seeing dropouts, loss in tuition revenue. And so for us, that's been kind of the big selling data point.
Great.
Yeah, I just a follow on to that, much to like the last two questions. So you have this 20 million rotating, every 4 years or post-grad type of student that's accessing your service. What's after they leave school, what's the carryover plan for them? Do they stay on this application? Is it integrated into their next therapist, or what's the transition if one?
Yeah, that's a great question, and something I totally missed in my pitch. So thank you for asking it. Again, one of the reasons why we decided to work with payers is that one of the biggest drop-offs that happens if you use the council on campus is that then you transition typically into a new city. You have to find a new provider. With Mantra, you can just continue care by using insurance and paying on your own. And so we've built a fully automated system that allows us to transition the care seamlessly to the student's insurance.
Great. Kevin, you got one question? You good? Good. Well, look, Ed, you XVCs, I always question XVCs, becoming operators. But it is a hell of a lot more fun being an operator.
Great.
God, you've done a great job. So awesome. We're going to move on from Mantra Health to Nathan Reed at XFERALL, and Nathan's got tech that speeds patient placements to the caregivers and specialists they need. Nathan, take it away.
Thank you. Good afternoon. I'm Nathan Reed, CEO of XFERALL. We have created a behavioral health patient transfer network. So our use case are addressing patients who are in a crisis, who are presenting into the ED, who have been assessed, who need to be placed in an inpatient behavioral health setting, whether voluntary or involuntary. Right now, currently hospitals, when that occurs, they pick up the phone and they start calling behavioral health hospitals. A lot of them just blast fax out to all the behavioral health hospitals in their region. And there's a whole back and forth process of phone calls and faxing that takes place just to accept these patients. National average for placing these patients is 8 hours of boarding time in an emergency room, which has a significant cost to the sending hospital. We built a mobile app, web app, that basically replaces all of the phone calls and the faxing and allows a sender to put in a request that then broadcasts out to qualifying receiving hospitals, to their intake departments. It allows them to communicate electronically. It meets all of the EMTALA HIPAA compliance. We're in a highly regulated space, as everyone here probably knows. It allows the clinicians to no longer be tied to a phone, but they can be anywhere at any time, communicating and helping getting patients placed. And there's a lot of variety of preferences. This is a mobile app in the App Store. You have to be an authorized user. So it's employees of a hospital. It can be law enforcement, first responders, community workers, things of that. Our objective is to reduce ED overcrowding, to divert patients from even presenting to the hospital EDs, diverting behavioral health patients from jails, improving access to behavioral health patients in a more effective way, and making sure they're getting the appropriate level of care. We're doing that by creating a network of senders and receivers that allows senders to communicate with one or more receiving hospitals simultaneously. The app clinically matches the patient needs. So a sender will go in and answer a very basic set of questions about the patient. We've built a national database of all the behavioral health receiving hospitals and all of their capabilities and services. And no longer does that sender need to know what each hospital's services provide. The application automatically matches that. That becomes very important as new behavioral health hospitals open or they create new services. Maybe they created a military program. No longer do they have to spend money marketing and sending business development out to try to educate everyone in the community that they now have a military program. And no longer does that sender even need to know that that happens. The app does that for them. Secure real-time messaging, team chatting. There's no more faxing. All the documents are attached directly into the app. And then from that, we get a baseline of a lot of data analytics that becomes very valuable for a receiving hospital with how their intake and business is actually operating so that they can use data to drive their business. So for the senders, we're dramatically reducing ED boarding time. We're reducing harm events for patients and employees. These patients who present ED are high risk. They harm themselves, they harm the nurses, physicians, and others. We're establishing a transfer system of record to help them keep up with regulations. We're tracking their transfer patterns, and we're helping divert patients from the ED. For the receiving hospitals, we're improving their intake operations. We're helping them build better relationships. We're making it easier for their customers to send them patients. We're giving them data at their fingertips real time so that they can manage their business and look at the market as a whole and determine if they need to add certain services because there's a market need. Who's using XFERALL today? We launched the product in early 2019, beginning of 2019 in Texas, in the Panhandle of Texas. We are doing medical placement as well as behavioral health placement, but the behavioral health placement took off like wildfire from a business, and as a startup, path of least resistance is where you go. So all the blue dots are hospitals across the state of Texas who are participating. We have a significant presence in Houston, in Dallas, Fort Worth. We launched Georgia in March of last year, just as the pandemic hit, and have seen expansion there. And Washington, DC launched just a couple months ago. We do have law enforcement using the app. We have first responders using the app, as well as nurses and physicians. We have proven results now that we have data for 2 years. The red line is the national average of 8 hours. The orange line is our times in Texas. We're consistently around 2 hours of placement time in Texas on the app, and in Georgia, we're under an hour. So that's significant time being saved, which is better for the patient, better for the patient outcomes as well. We have data where we can see things like the COVID impact. There was a lot of anecdotal, statements about people not presenting in the ED. We can actually measure that, and we're able to show that behavioral health patients truly weren't presenting in the ED during that time. And then lastly, we're saving the health systems a significant amount of money. We're in small community hospitals as well as large health systems. This is a case study, a 17 hospital system in Houston. Their average median time to place patients was 9 hours. By January 2020, it dropped to 2.5. So that's 1,200 hours saved a month, which adds a real dollar amount to their health system of savings. We have done this with a very small round A investment from a strategic partner, and we're actually in the midst of looking for a round B raise, really for more national expansion.
Nice. Nathan, great progress. And, especially with COVID, it was probably even more challenging to adapt some of this stuff. I've got one question. What if a provider has a referral system in place? I know at UCSF, they have this integrated referral system to replace faxes and everything else, and we want to use one. I understand yours is, tighter and better, but have you encountered that yet?
It does come up. Most health systems are using something. When we ask how long is it taking to place their patients, what's the boarding time, it typically still is 8+ hours to get the patients placed, because the receiving hospitals typically are not participating in the network, where it's very limited who's participating, and we've changed that.
I see. So it's you have people that really care. This is what they're all thinking about, and this is their primary network.
Right.
I can jump in here. I love this app. In order to prevent like divert status or census and help census management. I also love that you're removing the analog technology there that it's still hospitals rely on. But how large is your sender and receiver network? Because you're talking about transports, skilled nursing facilities, long-term facilities, special care. A lot of times those things that getting an ETA on status at pickup, and that's well beyond even getting the doctor to discharge the patient. How are you building that network so that it's seamless for hospitals to actually manage that?
Yeah, so our focus is specific to behavioral health only, emergency placement. Unfortunately, there's not a lot of emergency transportation in certain communities. So if you're in Houston or Dallas, sure, there's services, but if you're not, it's typically the police who are transporting these patients. And so we're actually looking for transportation companies, and I think there are some starting up around the country for specifically for behavioral health transport, because the last thing you want to do is take someone who's suicidal and stick them in a police car to drive to another behavioral health hospital.
Thank you for that clarity.
Kevin?
You got great exposure to those kind of areas in Texas. What was your go-to-market strategy? I'd imagine it's tough to get in front of a lot of the hospitals.
It is. So, right. And we accomplished this with really no marketing and no sales effort. It was a startup effort of 4 people. The go-to-market strategy was to talk to the sending hospitals who have the biggest problem, right? The patients in my ED, they're here. A lot of times they're here for 5 or 6 days. They're paying for a sitter to sit with those patients. There's a huge cost to their organization for that. And so we got a few of them to come together and say, yes, we want to do this. And therefore we pitched it to the receiving hospitals who then agreed to do it. And it typically starts small with just a couple, and then it just organically builds on itself. We're now seeing patients get transferred across the state. So in Austin, Texas, where it may be a smaller market, the receiving hospitals come on and all of a sudden they start getting requests from San Angelo, which is 250 miles away, because that area is on diversion and they don't have any beds available.
Yeah, that was going to be my question, because I saw this working in urban centers. So you're saying you're starting to bridge and connect urban centers.
Correct.
Oh, wow.
Or statewide, yeah.
Very cool. Hey, Nathan, you got great business. Congratulations.
Oh, thank you.
Great presentation. You found a niche, and what's easy about your business is that you can go in there with a simple calculator and says you can reduce that. Again, the time to a patient. You can reduce the time to get that patient treated, and that's just money. Congrats. Okay, we're going to move on. Sara, you're going to go next. So Sara Potter LaHayne is she's head of Move This World, and it's a platform for schools and their students, and this is early age to high school, to better manage their emotions. And it's Sara, take it away.
Great, thank you. I'm just going to share my screen. Excellent. Sorry, 1 second. Okay. So Move This World is an organization that strengthens the social, emotional, and mental health of pre-K through 12th grade students, families, and educators. And like many of us who are parents in the pandemic, we're playing an increasingly active role in our children's education. Pre-pandemic, this was a problem where we had chronic absenteeism and suspensions, incident reports of conflict and violence, cultures that were not conducive to learning. But this has all been further exacerbated by the pandemic. If you weren't prioritizing mental health or social emotional wellness pre-pandemic, you certainly don't have a choice now. It's right in your face and right in your living room. So social emotional learning, if you're not familiar with this work, it's defined by the collaborative of academic social emotional learning as the process through which we explore and cultivate self-awareness, self-management, relationship skills, social awareness, and responsible decision-making. These are the critical life skills that help all of us succeed in school, in work, and in life. There's a tremendous opportunity here. There was pre-pandemic an opportunity, but especially now there's funding at the federal level and at the local level being fed to schools to support mental health and social emotional learning, recognizing that teachers and principals are looking for resources for folks who haven't necessarily been trained in how to support all of the stuff that we carry in our emotional backpacks, and providing space for students to unpack those emotional backpacks so that we can move through them and effective teaching and learning can occur. There's also a return on investment for social emotional learning. So social emotional learning supports academic outcomes and produces safer communities in the classroom and beyond. So how do we do this at Move This World? We support pre-K through 12th grade students through short form evidence-based multimedia to help kids and the adults in their lives identify, express, and manage their emotions every single day. So we have over 1,000 evidence-based multimedia assets. The best analogy for this might be 8-minute abs, but for social emotional learning, or Peloton, but for social emotional health. The same way you as a yogi might pull up a short yoga video and you may not be confident in how to move through your yoga class. Teachers and parents who aren't mental health professionals have this contained and structured support to allow their students to identify, express, and manage their feelings, unpack their emotional backpacks, and then move through it so that we can build a more resilient culture wherever we are, whether that's in the classroom, at home, or our entire district. These are students in Metro Nashville Public Schools who are following along with the video picture-in-picture, exploring specifically self-management. One thing that to know about the Move This World product is that it is developmentally aligned. So it's pre-K through 12th grade. There's a unique course, a unique scope and sequence. We developed this in partnership with the American Institutes for Research and the Curry School of Education at the University of Virginia. We provide ongoing data collection. So yes, we're measuring efficacy, which I'll talk about in a minute, but we're also tracking fidelity of implementation. So whether or not you're using this, just like a gym membership, if you belong to the gym but you never go, it's useless. We want teachers and families to be using this content, to be pressing play, so we're able to support them through ongoing coaching and on-site and virtual technical assistance if they're interested. One of the key differentiators, in addition to the digital evidence-based format, is the fact that this is embodied, is that it's experienced. We're not just consuming content the way we might sit back and watch a TV show. We're getting up and moving. We're connecting our mind and our body. So when I'm stressed, when I'm anxious, what's happening? My heart's racing, my palms are sweaty, my stomach's in knots, and being really able to connect that viscerally, that psychosomatic experience through techniques from expressive arts therapy. So we shake out our stress, we tighten and release our muscles, we focus on our breath, we embody our feelings, and that looks a little bit different. From younger students, there's a little bit more play and music and movement, but older students are also embodying and playing and using techniques like free write and group poetry to explore their emotions in deeper ways. We also launched an audio network in the fall of last year as a result of the screen fatigue we were all experiencing. And that podcast, the Emotion Motion podcast, designed for 3 to 8-year-olds and their grown-ups, we've experienced 3,000% month-over-month growth and coverage in the Wall Street Journal, CNN, and parents.com. We've impacted 1.5 million students to date, over 2,500 school communities. We're currently working in 89 districts. So we've experienced tremendous growth and are currently implementing programs in 38 states in the US. In terms of impact, we have completed a quasi-experimental study to prove the efficacy of this work, looking at decreases in incident reports and suspensions, and how we can build safer, supportive, more resilient environments for learning. And then, of course, anecdotally, we hear the most beautiful qualitative stories of how kids are using these strategies to manage their emotions, not just in the classroom matters. So I've been talking to you. I'm Sara. I'm a Fulbright scholar. This is how I started Move This World. Some of the team is made up of mental health professionals, creative arts therapists. And what can you do to support Move This World is introduce us to school leaders and district leaders who are prioritizing mental health and social emotional learning, because that's how we continue to get this content in the hands of more students and educators and families. Thank you.
Well, yay, Sara, man, this is great. I've got kids. I know this is important. I love it. I love it. I love it. I love it. Hey, let me turn it over. Nico, you go first. What do you got?
Yeah, no, I love this. It's fantastic. And I see that you're in some of the biggest schools. I don't know the names of all of them, but what would be beyond that? What's your expansion strategy to gain momentum, to increase that? So you said 200 to 255%. Congrats. Yeah.
Yeah. So last year we grew over 100% year-over-year revenue. This year we're on track to do 255%. The next year we're also projecting to be 255% growth. So more than doubling our revenue year over year. And believe it or not, that's still like 1% of the school districts in the state. So we're really focused on penetrating this work. There aren't many organizations who do digital evidence-based social emotional learning in the way we do, that is frictionless, easy to implement, fun, creative, embodied. Our biggest competitor is actually a nonprofit that's been around for 40 years and does this in a very stagnant way. It's basically a curriculum in a box. It's like a shipping company. The curriculum sits on the shelf and never gets used. So we're really focused on trying to capture the market, especially at a time when people are prioritizing social emotional learning and they haven't had a program in place, and we have this track record and all of this efficacy to take advantage of that. But I think beyond that bigger picture, we're very excited about the consumer moment that's happening in education, the opportunity for parents to play more of a role through different media extensions, more podcasts differentiated by age group. We've seen the traction of our 3 to 8 year old podcast. We're really excited about an adolescent podcast. We see children's books, TV shows, lots of opportunities to bring this content into the home and beyond the school buildings.
Yeah.
That's great. Well, good. This is fantastic. Why don't we going to, Sara, great stuff. We're going to move on to our last company. And our last company is it's Kimberly Sarong from Theatros, and it's tools for HR departments and benefits groups to better manage mental health challenges. Kimberly, take it away. And you're muted.
Okay, I think I got my act together now.
Great.
Tiatros makes it possible for the first time for millions of people to access highly effective and affordable mental well-being and social support services. Our multidisciplinary team of expert clinicians and technologists collaborated with thought-leading providers and employment benefits, workers' comp, and health insurance experts to create a versatile platform where millions of people can access services that rigorously adhere to the latest evidence-based psychotherapeutic and social learning practices. Medical and psychiatric experts quickly tailor Tiatros interventions that meet the specific needs of many different user populations, while artificial intelligence tools optimize the individual user experience. Another major differentiator is that our platform uses patented technology-enabled high-impact community interaction, where users engage with their peers working asynchronously but together, sharing experiences and practicing new skills and behaviors. This uniquely social approach to mental well-being is a critical innovation because loneliness and social isolation are epidemic now, and they're deadly. This is why top provider systems, the American Heart Association, and Fortune 500 companies are partnering with Tiatros. Large companies trust their employees to Tiatros because we report quantitative impact data. We showed Salesforce that Tiatros moves employees with moderate and severe levels of clinical anxiety and depression back into the normal healthy range. We report hard data that show Tiatros reduces stress-related physical symptoms by over 30%, which immediately reduces Salesforce's healthcare provision costs as a self-insured employer. We also empirically documented sustained behavioral changes that correlate with increased productivity, higher employee retention rates, more effective teamwork, and increased innovation across their workforce. That's why Salesforce's CFO and president of HR made a value on investment driven decision to roll out Tiatros services to their entire global workforce a year ago. For another example, Metro Nashville Public Schools piloted Tiatros last year. 94.7% of the 220 plus pilot users completed their entire Tiatros program, and 100% of them materially improves their mental and physical health. This led to the teachers union asking for Tiatros to be added to their insurance plan as a 100% paid benefit. We're prioritizing integrating Tiatros services into chronic disease treatment protocols to address for the first time the economic impact of comorbid chronic and mental health conditions on a population health scale. We've partnered with the American Heart Association to integrate Tiatros into diabetes, heart disease, obesity, and stroke care plans. Our first jointly created Tiatros program for cardiac rehabilitation was successfully piloted at UCSF. Our UCSF collaborators want us to roll this program across the statewide University of California health system this year. We've also partnered with experts at the LaHayne Health System to integrate Tiatros companion programs into their cancer treatment protocols. LaHayne oncologists are prescribing Tiatros standalone companion programs for both their early and late stage brain tumor patient populations and for their patients' family caregivers. The funding that we're raising now will allow us to expand and commercialize these projects and to pursue other strategic opportunities to partner with chronic disease experts. Tiatros has two superpowers. First, we are the only enterprise-ready solution that rigorously adheres to evidence-based psychotherapeutic methods. And second, Tiatros has pioneered a uniquely social approach to mental well-being that meets users where they are today and guides them towards their personal growth and health goals. Everyone works at their optimal level of emotional depth, preferred pace, and schedule on the Tiatros platform, choosing the specific interventions, content, and tools that will help them achieve their own mental health goals and can continuously strengthen their mental well-being. This is how we achieve mental and physical health improvements across diverse user populations that are consistently comparable to expert in-person services. We can do this at scale at a low price point, reaching millions of people who need effective mental health services across the United States and around the world. We optimized our platform with paying customers over the last 2 years without diluting our stakeholders. Now we're aligning with channel distribution partners to distribute our services into the government, global benefits, healthcare, and workers' comp markets. Our existing customers and partners have already committed to participating in this race, and I'm looking for a lead investor who wants to help us build on our existing momentum to build a very large company that democratizes mental health. Thank you.
Wow. Kimberly, great job. You know, I never, you've got the data to back up that your product works. I have a question. My question is, I rarely ask this, but how? What does the patient do? Tell me about how the product works. I didn't get, and I know we were running out of time, but if you could do that in less than 30 seconds, that would be fantastic.
That's a challenge. Patients access Tiatros whenever it works on their schedule, on their personal devices, wherever they are in the world. We have taken all of the elements of evidence-based psychotherapy and into a platform with social support services where we put people in peer groups that are facilitated by social learning experts. They're overseen by expert psychotherapists, and we take people from wherever they want, let them choose their path toward better well-being. And that's probably about the best I can do in 30 seconds.
Okay, I get it. I get it a lot more. Nico, Kevin, anything?
You covered the question I had. I wanted to dive deeper into the product. So thanks for that, Kimberly. That was great. That was really helpful. It's great progress.
Yeah, we'd be delighted to show you a live product demo. We'll take you into the product and show it to you.
Great. Kevin, anything? Okay.
I was going to ask about product too.
Well, we've actually run way over time. And so, while we have I think us judges were prepared we had a whole slew of amazing questions to sort of make make all of you guys sweat. But we don't have time because we have Kim McNicholas that comes after us, and you cannot basically impinge on her time. So really with that, each of us judges are we've sort of thought through, we've thought through our top 3 companies, and we're going to start with Kevin, and then Nico, I get to go last, and then then Ashana, you get to go, and then I'll go last. Tell us we're going to tell you what we think of the top 3 companies, and at the end we'll obviously figure out who are all the winners, although all of you guys are winners. Nico.
Yeah, no, and just to echo, I think you all are winners, solving some really amazing and big problems across this spectrum here. My top 3, I go from Move the World. I just loved starting early into the life of children, right, where they're like trying to settle down and trying to get educated, and that's a big part of emotional regulation there. So kudos to that. Mantra, I love the idea of then building upon that within the educational space and the growth. And I think there's a potential to bridge as a standalone for mental health, just support for that age group and beyond. And then Floreo is close to home, but I loved the model of where they're growing into the various different parts and actually including the pairs into that. And there's a big nut to crack there with Easter seals and the various different services. So those are my top 3.
Shit.
I guess I'm up next. I really liked Mindset. I thought the kind of existing application of voice, even in person, kind of lends itself well to being digitized, and like to focus on building vertical specific interfaces for each of the issues. Really liked Daybreak, like the mission of kind of bringing kids and families together and giving more widely distributed help to them, and also really liked Mantra. And like the approach to schools think they're solving a huge issue. There's massively constrained demand, and there's always kind of a captive audience, and like how you've kind of built in a bridge to care after college. And there's a lot more. Well, all the other companies were extremely interesting, and I think there's some folks that I have to spend a lot more time digging into. You have far more very complicated solutions that I think are also going to be extremely interesting in the future.
Shauna, it's all you.
Hey, so I really think from a clinician's perspective, Floreo, that's a space to be disrupted. And it's like a child with special need impacts everyone around them, from parents to employer to everyone, actually. But most importantly, the child, the earlier you start the intervention, more likely that you will have a high functional individual. And the fact that it's scalable across different conditions, eventually way more conditions than we predict. Second is Daybreak Health. I think that's another market to be disrupted. I feel like you could finesse a little bit more on your solutioning and go to market. And then the third one is Mantra. That's a gap in care when the kid leaves home and goes to college. And those are the areas that we could actually impact. So all of the 3 things are gaping markets to disrupt from my perspective.
Fantastic. Well, look, I actually like all you guys, but I put my VC hat on, because I thought that's what we really need to do. And so I'm thinking about where is there most money to be made? Because that's what I've been told to think as a VC. I used to be an entrepreneur, and that wasn't necessarily how I thought. But as a VC, you have to think that way, because that's what your LPs want you, how they want you to think. So I guess where I ended up, Tiatros, you were there. I loved so much of what you said. You're gonna make you my third. I still don't understand the product completely, but you're still in there. And there's something I like that, and how you're basically packaging this together, and you're obviously having some real success financially. So I love what I heard. Daybreak Health. I mean, maybe because I have teenagers, I'm overly biased on this, but I know there's nothing there. Because I've spent the time looking. It's a market that's really begging for some solutions. You're moving down the road in reimbursement. I love how you have the parent and the school, potentially the school model and the student model. And so Daybreak, you get my vote. I think you're absolutely onto something. Ed, even though you're XVC, I'm going to let you're number one for me. And I didn't want to do it, but I'm going to. And Mantra Health. So look, I think it's what I like so much about what you're doing is that I think they're really great enterprise customers that you get to sell. And that's I've made my share of educational and healthcare investments where you end up selling clinics or small schools, or and it's just really hard to scale up, right? And then or hard to get profitable. But I like the idea of selling to universities. We know that they have the money, and God knows this is a problem. I'm on the board of Penn, and this was half of the board of directors topic this year. So the folks at Canaan are smart to back you. So you're my top one. So with that, that's my money. That's really, I put my money filter on. So what we're going to do is 4 of us judges, we're going to send out an email, and we'll basically, sort of professionally collate these things. Congratulate all of you guys. Make sure get this out to all of our venture capitalists. At Health Hub, we have about 70 or 80 venture capitalists that invest in mental health. So at UCSF Health Hub, I'm going to make sure that I'm going to get this list out to people. Arcino and Bambi, you've done an amazing job today. This is I think the most curated one of any of your programs, and it's my privilege to be on it. And really, with that, thank you all. Thank you very much.